Good morning. Welcome to this presentation, Meet the Expert title, Self-Compassion Skills for Cancer Patients and Caregivers, with our expert, Dr. Jordi Ponce, licensed psychologist in behavior medicine at Moffitt. Meet the Expert is brought to you by Moffitt Cancer Center's Patients Library and Welcome Center. Please visit moffitt.org, Meet the Expert to see our upcoming sessions. The content in this presentation is not intended to be medical advice, and the viewers should consult the physician if they have any medical questions. This should not rely on information contained in this presentation for immediate or urgent medical needs. If you think you might be having a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because you watched this presentation. Now, please welcome our expert, Dr. Polsey.
Hi there. Thank you so much. My name is Jordi Ponce, and I am a licensed psychologist, and I work at Moffitt with patients and families who are adjusting to all the many changes and all of the psychological factors that come along with through this journey. And if there was one set of skills I think everyone on the cancer journey and caregivers could develop, and pretty much everyone in general, it would be self-compassion skills, ways to be a little bit kinder to ourselves, especially when under stress, as a means of coping. So I'm really excited to go through this presentation and not only share with you a little bit about what it means to be self-compassionate, but then also hopefully give some specific tools or skills you can use to start practicing it. So the first obvious question that may come to mind is, what is self-compassion? And I'll just give you a moment to kind of reflect a little bit upon what comes up for you when you hear those words. When I talk about self-compassion, whether you've heard of this concept formally or not, what kinds of ideas pop into your mind, or what thoughts or images do you have? I know that for me, the general idea that I have is how to take compassion that I would be able to offer someone else and figure out how to turn it toward myself and offer that kindness and compassion to myself when I'm tending to be a little bit self-critical. So self-criticism is a great way to start thinking about self-compassion because it tends to be kind of like the opposite. So self-criticism involves engaging in negative self-evaluation, resulting in feelings of worthlessness, failure, and guilt when our expectations for ourselves are not met. And my question for all of us to consider is, the cancer journey can be fertile ground for self-criticism for both patients and caregivers. And so you may want to ask yourself, in what ways have I noticed myself being self-critical along this journey? And I can give a few of my own examples. So I'm actually a patient at Moffitt as well as a staff member. And so I can relate to this. And I know that sources of self-criticism for me can include when I don't feel like I'm shielding family and friends from some of the challenges that I face or some of the difficult emotions. I can tend to be self-critical. Also, when I feel like I'm not being as productive as I used to be because treatment can make you feel tired, or if I feel like, there are more things I should be doing for my health, like exercise, eating, that sort of thing. It's easy to get pretty self-judgmental. So I'm sure you have your own examples, but as you can see, going through cancer is a time that can be ripe with self-criticism because there's a lot of stress that we're under. But if I said to you, here's some advice, be less self-critical, how helpful would that be, right? Not very. Anytime we kind of decide to be a little more like this or try to be more like that, without specific action items or steps you can take, the advice isn't really all that helpful, right? It's hard to go out and figure out if you are making progress or not when something is so general and nebulous as be less self-critical. So it's helpful to know a little bit about self-compassion and some of the tools so that you can start to combat that self-criticism with specific things you can do in order to be a bit kinder to yourself and then get the positive results that research suggests self-compassion brings. One of the people we have to mention when we talk about self-compassion, well, the person we have to mention is Dr. Kristen Neff. She is kind of like the pioneer leader in understanding and defining self-compassion, doing research on its impacts in various fields. And she has a fantastic resource. It's self-compassion.org, which you see at the bottom of the slide here. And the idea is you can explore this website and learn how she defines self-compassion, which we'll go over in a minute. Something called fierce self-compassion. You can look at the research. And I really like this one. There are self-compassion practices that I think are super helpful that include some mindfulness meditations that are recorded so that you can actually practice self-compassion based mindfulness and listen to the recordings. It makes it super accessible and easy. You can even test your level of self-compassion to see, are you someone who tends to be pretty good at this, or is there room for improvement? So again, that's self-compassion.org, and look for work by Kristen Neff. A way to define self-compassion is simply the process of turning compassion inward. We are kind and understanding rather than harshly self-critical when we fail, make mistakes, or feel inadequate. We give ourselves support and encouragement rather than being cold and judgmental when challenges and difficulty arise in our life. Research indicates that self-compassion is one of the most powerful sources of coping and resilience we have available to us, radically improving our mental and physical well-being. So if that doesn't catch your eye, that it's one of the most powerful sources of coping and resilience, I don't know what will, right? So clearly this is an important skill set. And we can think of three elements of self-compassion if we want to break it down into a slightly more complex level that includes mindfulness, common humanity, and kindness. So mindfulness refers to the ability to step outside the current of what we're experiencing and just simply be aware or label when we're struggling, when we're having a hard time, when we're having a hard day, and when we're struggling with self-compassion or when we're being self-critical. So rather than living that moment all the time, it's how do you step outside of it and say, wow, Jordy, this is a really stressful week, or you're having a really hard time with XYZ, you're struggling. That's one of the first things we can do is just sort of recognize when we're having a hard time and be mindfully aware of our experiences. The second is this idea of common humanity. So often when we are struggling, when we feel like we're not measuring up or we're having a hard time, we're encountering challenges in life, we tend to think of it as kind of like our flaws or that we're uniquely messing up and we're not keeping up with where we should be. But actually, struggle is part of the human experience. We're all going to face struggles and challenges, especially along the cancer journey. And so it's removing the idea that we have to be critical of ourselves for every time we struggle or don't measure up, and replace that with the idea that this makes us part of common humanity. It actually links us to others and is sort of part of the human experience. So if you think about what really bonds us with other people, one of the things that can be really bonding to others is when we share our vulnerabilities and our challenges. And so recognizing that we don't have to be perfect and that there can be humanity in the struggle. And then the last element is kindness. So this idea of treating others, treating ourselves like we might treat others. So often we say things to ourselves when we're being self-critical that we wouldn't say to our friends or our family who would be going through a similar struggle. In fact, we wouldn't even say some of the things we say to ourselves to people we don't even like that much, right? We can be really harsh. How do we replace that with the same kind of talk or treatment that we would give, the same grace and compassion we would give to a loved one or someone else. So if there weren't barriers to doing this, we would all probably be in this mode of kindness to self. So, what are some of the barriers that you may experience that may get in the way of being self compassionate? Just kind of a question to ponder and think about on your own. For you personally, as you walk through the cancer or caregiving experience, what thwarts your ability to be self compassionate? So, for example, I know for me, sometimes it's that lacking of mindfulness. So I'm not always aware and stepping back and saying, this is a struggle and what do I need? I might need to be a little kinder to myself. Another barrier is that sometimes I fall into the faulty belief that if I'm self critical enough, I can kind of beat myself into submission and then hold myself accountable and do better. But often I find myself more motivated to change when I'm coming from a place of kindness and encouragement than when I'm coming from a place of criticism. So some of the barriers might be lack of mindfulness or being afraid of being self-compassionate because we feel like we have to hold on to self-criticism. But I'm curious just for you to ponder what are some of your own personal barriers to being able to offer yourself compassion. Often our personal histories and how we've learned to be treated or to treat ourselves can be really complex and complicated when you think of childhood issues and family. And so practicing self compassion may be really foreign to some people because it is sort of not how a person grew up, really offering or receiving that kind of kindness to oneself. Okay, so we've talked about how research suggests it's a powerful tool, and I wanted to share with you a little bit of research findings so that you can see the ways in which self-compassion has been shown to be quite effective for people. So, self-compassion in the research literature has been associated with reduced burnout among nurses. And we want that, right? That's great when our nurses aren't feeling burnt out, when they're able to practice self-compassion. Increased self-care behaviors among women with breast cancer, social support, sense of belonging, and resilience among women with breast cancer, reduced threat-related rumination and worry in cancer survivors, reduced care burden and distress among caregivers, higher quality of life among patients undergoing antineoplastic chemotherapy. Right? So we're seeing that when people are able to practice self-compassion, it's associated with some pretty amazing things like reduced burnout, increased self-care, sense of belonging and resilience and social support across various groups and populations. It's also been associated with reduced distressing cancer-related cognitions. So if you're someone who tends to ruminate and have a lot of distressing cognitions pop into your mind about your cancer, self-compassion may be a really neat tool to try out. Reduced depression among family caregivers of patients with lung cancer, a potentially protective effect on body image disturbance among women with breast cancer. And people are going through a lot of body changes, and so self-compassion may be a helpful tool along that journey. Open communication about cancer in couples facing lung cancer, and less shame and fewer depressive symptoms among lung cancer patients with smoking histories. So when we talk about the literature, there's a decent pool that suggests that people going through the cancer journey or people who are caregiving, whether that be nurses or family and friends as caregivers, could really use self-compassion in a way that could be effective for a lot of these outcomes. And here are some references to show you where I was pulling some of that information from peer-reviewed journals that suggest that these outcomes are associated with self-compassion. All right, so like I said before, just saying, hey, be more self-compassionate. Here's the definition, and here are three pieces of the puzzle may not be as helpful as talking about specific skills that you can go off and start using immediately. So as we talk about these different skills, I would encourage you to pick one or two that I mentioned and start trying it and monitor the results. So one of the first ones is increasing your self-criticism awareness. So remember we talked about that mindfulness piece to be aware of when you're struggling and when you're being self-critical. And sometimes when we're really busy or in it, that can be a barrier to self-compassion. This would be, how do you increase your mindfulness or awareness? So I've broken this down into 3 steps. Number 1, when you're feeling particularly down or frustrated with yourself or anxious or distressed, you can use those feelings as a cue to say, okay, I'm really feeling it right now. Let me use that as a cue to be mindful and start noticing the thoughts that I'm having and be aware of what's running through my mind. So the next time you're really stressing out about cancer, you're really stressing out about caregiving, say, okay, that's my cue to slow things down and try and just be aware of the types of thoughts I'm having and how I'm treating myself. Are any of these thoughts self-critical? Step 2 would be to verbally name the self-criticism. So you might even say out loud, okay, that's self-criticism talking when I say, like I'm not getting it. I should be getting more done around the house, even though I'm exhausted with chemo. That sounds like some self-critical talk. Or, oh, I'm being lazy today. That sounds like self-critical talk. Or maybe you're even just saying, I'm kind of being hard on myself right now for someone who's going through a lot. So verbally name that it's self-criticism, and then take that thought or those thoughts and refer to them as the rough draft, right? It's okay to have an initial self-critical thought, but we're going to call it the rough draft thought that you're going to revise in a way that is less self-critical. So restate the thought in a way that feels like maybe a way you would describe it or how you would speak to a friend who you were supporting and encouraging. A couple great warning signs for self-criticism, if you want to pay attention to the types that might pop up in your thoughts. If you notice yourself engaging in labeling, there's a good chance you're being self-critical. So calling yourself stupid or saying, I always do XYZ, or I'm so lazy, or I can't do blah, blah, blah. When you add these labels, I'm stupid, I'm lazy, I never do XYZ. Those labels are really good indicators that you are not being very nice to yourself. The other big one is should statements. When you hear the word should, your ears should perk up and say, maybe I'm being a little bit self-critical here. Let me examine that thought. So we do this all the time, right? I've given examples of like in my own experience, like I should be doing more around the house, even though I feel tired. I shouldn't have become irritable like that with my family. I should be eating less of XYZ because I'm trying to eat healthier. When we use the word should, we're suggesting that there's a higher standard out there and we're not measuring up. So we're criticizing ourselves. And so anytime you hear the word should, and we'll talk about what to do with that, that's a good indicator that you are being a little harsh on yourself. And if you notice yourself disqualifying the positive. So you may have done 100 awesome things in a day to help caregive or to manage your cancer or to live your life the way you want to. But we find a way to make those things not count as much. And the several mistakes we made, well, those are the big defining things of the day. And that's how we judge or criticize our behaviors. So remember, even if you make mistakes or do things you're not happy about, don't disqualify all the positive things that you're also doing. Another tool or skill, very simple, is how would I treat a friend? So once you get good at noticing your self-critical rough draft thoughts, ask yourself, would I say this to a friend who is struggling? If the answer is no, then what would you say, right? So you might go from, I should be getting more done around the house. You might say, well, what would I say to someone else who's really tired and not feeling well from chemo? Maybe I would say something like, wow, you are going through a lot and you had chemo. I'm amazed you got anything done. You're doing great. That's awesome. And then you kind of turn that statement toward yourself. Okay, so we're talking about those should statements again. there's this neat tool about replacing should with want. So there are several steps to this one. First, notice that should statement. So in this example, I have, let's see, I should not be so irritable with my family, right? It has a little bit of a critical, judgmental tone. It's saying that there's a standard out there of how we should behave, and we're not meeting it up. We're not living up to it, right? It's a little bit self-critical. Step two is remove the word should and report unbiased facts. So act like you are reporting for a newspaper and it's not an editorial, right? You're just reporting what happened with no judgment, no opinions, nothing. So it goes from I should not be so irritable with my family to the fact of I'm being irritable with my family today. Like neutral, just the facts. And then step three, you can add a want statement. What do you want moving forward? I want to go say something kind and share gratitude with my family. So look at how far we've come from self-criticism to a more compassionate approach. You go from, I should not be so irritable with my family, where you're kind of kicking yourself for how you've been acting, moves to, I'm being irritable with my family lately, so I want to go say something kind and share gratitude, right? Much more action oriented and neutral or self compassionate. Another possible skill is to think about what inner voice you're tapping into. And I think of these three major voices that we can sometimes vacillate between: the drill sergeant, the cheerleader, and the coach. So, one of the voices we sometimes use, especially when we're being self critical and when we're stressed and feel like we need to hold ourselves accountable or do better, is the drill sergeant. This is that voice that's like, all right, you maggots, you got to get this done and you shouldn't be doing that. And, it can be highly critical, highly judgmental. It's kind of where we yell at ourselves. We think we can beat ourselves into submission and do better. And sure, sometimes that may be helpful, like in times of absolute crisis or war. But considering that that's not necessarily where we are most of the time, we probably have room to replace that drill sergeant behavior with something a little kinder. I think sometimes we hold on to this because we think we can shame ourselves into doing better, but that isn't usually highly motivating. The cheerleader, on the other hand, is someone who's just always on your side, always encouraging. They're going to have words of affirmation and cheer you on no matter what, which is awesome. We all need someone like that in our lives, and we need that cheerleader inner voice. But there are times where we do want to hold ourselves accountable and take a look at things we want to change. And so sometimes the cheerleader isn't all that motivating or helpful either. We don't feel like we're being honest. So what we want to do is tap into someone more like the coach. So maybe you've had someone in your life who was an athletic coach, a piano teacher, or a school teacher. Maybe you had a mentor or a boss or a supervisor, someone who really coached you. They knew your strengths. They wanted what was best for you. They weren't afraid to hold you accountable and say, hey, I know you can do better, but they helped you leverage your strengths to make positive changes and reach your potential. So when you think about that, I'll give you a minute. Who is someone in your life who had that coach's voice, who really encouraged you and motivated you and got you to make positive change and reach a lot more of your potential? So for me, I'm identifying a middle school soccer coach who really helped me take my game from pretty abysmal to a whole lot better, because he just knew how to encourage me and build me up and capitalize on my strengths. So I sometimes think of his voice and try and channel that when I am struggling with being self-critical or really wanting to hold myself accountable for something. And that can be highly self-compassionate because these are people in our lives who have encouraged us and nurtured us to make positive change. Other options can include journaling through a self-compassionate lens. So journaling can be a wonderful outlet for our thoughts, our feelings, our emotions. And you can actually choose to journal and only write from a place of self-compassion. And it might be challenging at first, but you're training your brain to really think about yourself and talk to yourself in a super compassionate, kind way, a way that you would treat a friend you cared about. And for caregivers, it's very self compassionate to take time to take care of yourself before burning out. And this can be challenging when you're working with folks who have really high needs or you're very busy. But it is important to find times to recharge yourself, give yourself permission to take care of your own needs. You might actually be better at serving the person you're caregiving for if you yourself are feeling recharged and healthy. Off the job, you may want to take a yoga class, spend time with friends, get a massage, do things that are designed for self care. And while you're caregiving, give yourself soothing words of support. You may need to step aside when things get intense or frustrating or really difficult and give yourself some words of affirmation or ask someone else to provide that for you. And take specific self compassion breaks. So you can take 5 minutes in a given day to just step outside and say, I'm going to give myself some positive affirmations, direct some positive energy my way, maybe even go on Kristen Neff's website, self-compassion.org, and do a quick self-compassion meditation. And like I'm mentioning, there is self-compassion based mindfulness. And so you can use those guided exercises. I have an image here of some of the options that are available. And as you can see, they range from 5 to 6 minutes all the way up to 20 minutes, depending on how long you want to take, just really focusing on developing those self-compassion skills. You don't have to do it all on your own. There are resources. So that is really the main set of ideas I wanted to share with you about using self-compassion along the cancer journey. Remember that the research shows that it really can lead to or be associated with some important outcomes that will help us along our cancer journey. And if you do have any comments or questions or reactions, you can feel free to get in touch with me. I'm happy to talk about self-compassion whenever. It's a favorite topic of mine. And so you can get in touch with me, and my information is on the Moffitt website. So if you have further questions, you can contact our department in supportive care medicine, and there's information on more of Moffitt's library programs at the information below. So that's it for me. Those are my thoughts on self-compassion. Good luck practicing.
Thank you for being in the sessions. We offer live Meet the Expert sessions through Zoom. To see a full list of upcoming sessions, please visit moffitt.org Meet the Expert or call at 813-745-1690. Thank you.